You've made the decision to start therapy. Great. Now what? I want this video to be informational as well as conversational, even though it's me talking to the camera, about the whole process of starting therapy. Of course, at any time, if there's something comes up in this video that I did not speak on or you are left questioning more, please feel free to email me and ask. There's a number of different ways that you can connect with a therapist. The first step is the search. Who to connect with. Multiple ways that you can do that. You can do an online search, simply therapist in your area, or therapist by specialty, therapist by problem that they help treat. More than likely, it's going to be the best way to find a therapist that's close to you, or at least in your state. Some therapists are only licensed in one state, but there are a few that are licensed in multiple states. So just be mindful of that as you're looking. When it comes to looking for particular problems, anxiety, depression, of course, top of the list. So you can look for a therapist, so anxiety therapist in your area by zip code or town, whichever you'd like to, or state. Another way is through therapist directories. There's Psychology Today, there's Therapy Den, there are a number of other ones out there, but those are some of the top two. If you're looking for someone that does a particular type of therapy, such as dance movement therapy, like me, there is a directory specific for dance movement therapists on the American Dance Therapy Association, or adta.org. There are also other directories for therapists that are trained in EMDR, which is eye movement desensitization and reprocessing. Also brain spotting. There's a whole directory for that. For internal family systems, IFS, there's a whole directory for that. So if you are looking for a particular form of therapy, see if there's a directory that has the list of therapists that you can connect with in your area or by state. Another way that you can find a therapist is by asking your doctor or asking other health-based practitioners. That can actually include massage therapists, physical therapists, chiropractors. Ask around to your family and friends. See if they know anybody that works with a therapist or knows of a therapist. So there are a number of different ways. What it comes down to is making sure that you are connected with someone that is going to help you reach the goals, the whole reason why you're going to therapy. I myself say that I'm not a one-size-fits-all therapist, so I don't think I can be of most service to everyone. But the way that I can be of service to you or someone that is not necessarily a match for me is connecting them with someone that is going to be a match for them. That is my main purpose. My main focus is just making sure that people are finding the ways that are going to help them to feel better, do better, and be better in their lives, whether that's working with me or not. Let's say that you've found the therapist that you want to connect with. Maybe they've got a website where they have their email, their phone number, or on their directory page, they should have their contact information. Reach out to them. Ask them if they offer free consultations, a way to just meet with them, ask some questions, get to know if they're going to be a match for you. I myself offer a free 20-minute consultation. That way I can gather a very small overview of what's going on for you, and I can share some information about how I can help you. And then we can go to the intake session. At the consult, I would suggest it's not a therapy session. So try to be prepared to have at least a couple of main points of what you're wanting, why you're wanting to start therapy. So at least have those points ready. And have any questions ready about the therapist. I always welcome questions about what I do, how long have I been in practice, how can I help the individual with their particular problem. So a number of ways that I can, that consult can be the first point of contact to make sure that we're fit, we're a match. And like I said before, I'm all about connecting to other resources if I think that would be better. With the intake session, it's again not exactly the same as a therapy appointment. It's very it's more about fact gathering. So there's going to be some initial paperwork that you're going to fill out, including your medical history, current symptoms, history of those symptoms, work history, relationship history, and some other information. Once that paperwork is filled out at the intake, we'll go over that information that you filled out, as well as hash out the goals. Again, why are you coming to therapy? And that's a very collaborative process of what you're wanting out of the process and how I can help you to get there. The intake, again, like I said, is not like therapy. It's just about getting what's gone on in the past, what's currently going on, and then talking about where to go from here in the whole therapy process, which can be anywhere from 6 months to 2 years. It really depends on the individual and what's going on for them at that time, the ups and downs, because therapy is not a linear process. It is very up and down, just like life is up and down. I would encourage you that even if you're feeling good and feeling great and questioning should I go to therapy today? I'm feeling good. Yes, that is actually a really great time to go to therapy, because that's when you're in your clearest state of mind. And that's where maybe some more emotional, mental processing can happen of the problem. You can also, it's a little bit easier to create a game plan. Okay, this is what's happened. Here are some new ways that you can face the challenge, the problem in a different way. All right, let's try it out and then see how it goes. So it is a lot of trial and error in regards to what will work, what hasn't worked, how to tweak it and shift it and change it a little bit. So there's no clear-cut way that therapy goes, but it's all up to the individual and how much they put into it, and making sure that they have a very supportive therapist along the way. The role of the therapist, it's not my job to tell you what to do. I can give recommendations and suggestions for things that I think would be helpful, but it's ultimately up to you to take it, leave it, use it, not use it, and to have input in the whole process. I'm just here to be a guide to help you along the way, give you some directions and pointers, and just to let you know that you're not alone in the challenges and the difficulty of life and the beautiful times of life and the maybe in between, so the meh times of life. I'm here to be with you in that. I, of course, welcome any questions, any feedback that you have about any information that I shared on this video. I definitely hope that it's been helpful. Share it with others that you think would benefit from this, and take care.